Welcome to the BanishCancer channel. I'm your guide, Sarah. Today we're exploring a rare but serious condition, acute eosinophilic leukemia. Understanding its symptoms and causes can make a real difference, because early recognition often leads to earlier diagnosis and better treatment outcomes. Acute eosinophilic leukemia is a fast-moving blood cancer. It happens when the bone marrow produces too many eosinophils, a type of white blood cell. Instead of protecting the body, these cells can invade tissues and organs, causing damage. So what should you look out for? Let's start with the general symptoms. Many people notice fatigue and weakness that doesn't go away, even with rest. You may also experience fever or night sweats, where you wake up drenched or feel sudden spikes in temperature. Another red flag is unexplained weight loss, losing pounds without trying. But the symptoms don't stop there. Because eosinophils can infiltrate different organs, the signs can show up in many parts of the body. In the lungs, you might notice a persistent cough, shortness of breath, or even bronchospasms that feel like an asthma attack. In rare cases, eosinophils can affect the heart, leading to chest pain or discomfort that resembles a heart attack. The skin is another common sight. Around 60% of patients develop rashes or lesions, sometimes mild redness, sometimes itchy or painful patches. You may also notice swelling or pain in tissues, caused by eosinophils building up under the skin. The digestive system can be affected too. Diarrhea, abdominal pain, or even more serious complications like bleeding or ulcerations may occur when eosinophils invade the gastrointestinal tract. And some people experience muscle pain, a soreness or stiffness that lingers even at rest. Now let's talk about the causes. Acute eosinophilic leukemia can be driven by genetic factors. Certain chromosomal abnormalities, like a translocation between chromosomes 10 and 11, are linked to poor outcomes. Mutations in specific genes, such as the FIP1L1 PDGFRA fusion gene, can also trigger uncontrolled growth of eosinophils. But genes aren't the only factor. Environmental triggers play a role too. Exposure to radiation, for example, from previous cancer treatments, increases risk. So does exposure to harmful chemicals like benzene, often found in industrial settings. Other contributing factors include a history of blood disorders, such as myelodysplastic syndromes, or a family history of leukemia, which can increase susceptibility. There are also related conditions worth knowing about. Hypereosinophilic syndrome, where eosinophil levels stay very high for long periods, can sometimes progress into acute eosinophilic leukemia. Chronic eosinophilic leukemia is another condition that, if untreated, may evolve into the acute form. So who is most at risk? Age and gender both matter. People over 60 are more likely to develop this disease, and men are affected more often than women. Lifestyle and environmental exposures, like working with toxic chemicals or having prior chemotherapy or radiation, also raise the risk. Because this leukemia progresses quickly, early diagnosis is critical. Doctors usually start with a medical history and physical exam, looking for signs like fatigue, weight loss, or enlarged lymph nodes. Blood tests, such as a complete blood count, can reveal elevated eosinophil levels. A peripheral blood smear helps identify abnormal cells, while a bone marrow biopsy provides a definitive diagnosis. Genetic testing is also essential, since identifying mutations or chromosomal changes can guide treatment decisions. So let's recap. Acute eosinophilic leukemia is rare but aggressive. Symptoms can include fatigue, fever, night sweats, weight loss, cough, chest pain, rashes, diarrhea, and muscle pain. Causes range from genetic mutations to environmental exposures, like radiation or benzene. Risk increases with age, male gender, and certain pre-existing conditions. And because this disease moves fast, recognizing the signs and seeking medical care promptly is vital. If you or someone you love experiences persistent symptoms like these, don't ignore them. Consult a healthcare provider. Early testing and diagnosis can make a real difference in treatment outcomes. Thank you for joining us on the BanishCancer educational channel. If you found this video helpful, please share it with others who may benefit. Knowledge is power, and together